My name is Enda O'Dowd. I'm Joint Course Coordinator of the MSc in Medical Device Design here at the National College of Art and Design. We are a very real-world program where we focus on human factors for the medical device industry. We take students, graduates from both technical and creative backgrounds, and we always have a nice mix in the studio of those backgrounds. We work very much on real-world projects, so we've just completed a project with Teleflex, which is a multinational with their European headquarters in Athlone. And our next project will be with Stryker's Innovation Centre in Cork. These projects are great because they're real-world briefs. We're working on, I suppose, the future of medical devices, but also with a very much a human focus and very much a design approach. So design for us is not just about aesthetics, it's very much around user experience. We do a lot of contextual inquiry in the hospitals, so we have a really good relationship with the Mater and with the Royal College of Surgeons and with James's Hospital, and we get to do a lot of real world projects with them. That also enables us to do a lot of real world research, so contextual inquiry would be where we would go into a surgical procedure and investigate the perceptions, cognition and action of the different stakeholders in that environment. We would then generate concepts, so we do a lot of, I suppose, a deep dive of human-centered research. That would be followed by a stage of ideation where we would sketch and sketch model. And all this work would be is then presented back to the company. So we produce a range of different concepts, and those concepts are then honed into a final design, which is again presented to the company. Our graduates on completion of the course, our graduates have quite a comprehensive portfolio of work, from working with the Royal College of Surgeons, with the different hospitals, and also with a number of multinationals. And they get to do their own self-directed, but always with a client final project. And that really gives them a really comprehensive portfolio to go to industry with. Most of our graduates, while it is very much a creative course, they're really valued for their human factors expertise as well. So when you're a human factors engineer, you have to be very critical and very analytical when it comes to the user experience of any medical device, because you can have serious issues if there are human factors issues, if somebody presses the wrong button or misunderstands a device, if the interface isn't correctly designed. So that's a really valuable person on a team for medical device development, and is also covered by the legislation now as well. So our graduates are very much sought after for the development of medical devices early stage, but also to be able to evaluate them and become the voice of the user right throughout the medical device design process. Medical device design process is very much a process of de-risking, and we're trying to take out those human factors risks as we go through the development process. So we're open for applications at the moment. We would be very happy to take applications from both creatives who are looking for maybe a career change and going into a world where there are a lot of opportunities, to be creative, but also you will learn a lot about the regulations and the hurdles that have to be overcome when you are trying to be creative in what is a very regulated industry. And we're also open for applications for people from more analytical backgrounds who would like to do something more creative and work in a studio environment and learn how to ideate in a very human-centered way.